All right, everyone. Good evening. Thank you. Welcome. Tonight's topic is stem cell therapy. It's an exciting topic. It's an important topic, and I hope for many of you tonight is an important night. I've had a lot of patients come through my clinic who began just sitting in a chair in a seminar similar to this, just learning about a topic. It's really the first step. First learning about, potential therapy, and then taking some action on it. So my purpose tonight is not just to teach you about stem cell therapy, but then to offer you a way to be able to take advantage of that, take some action, and see if you might be able to change your life. All right? You're here for a reason. Most of you probably are in some sort of pain, so we want to try to figure out how to get out of pain. And that's what we'll learn about. All right? So there's my purpose, to help you get out of pain and to maximize your life. I began learning about stem cell therapy after seeing the benefits of it in my own family. This is a topic that's very near and dear to my heart. That's me, obviously, and Clive. My father-in-law is pictured there next to me. This is just over 3 years ago on my wedding day. It was in November, late November, 3 years ago. Just over 3 years ago now. And by this time, by February, after this picture was taken, he looked nothing like that. He had leukemia. If you know anything about cancer, it means he had leukemia in this picture. We just didn't know. And he began to lose weight rapidly and was declining in physical strength. Like a lot of guys do, he was in denial and thought, no, it's just a cold, it's a cold. Well, a cold doesn't last for 4 months and cause you to lose 60 pounds, right? So after my wife and her sister and my mother-in-law were breaking down and literally begging him to go to the hospital, he finally did, and was admitted immediately to University of Iowa Hospital. They lived at the time in Cedar Rapids, which isn't far from Iowa City. In Iowa, University of Iowa Hospital is the best place to go. It's a great hospital, bar none, throughout the country. In Iowa, it's certainly the best. And so he was under care there in their oncology department and being treated for actually 2 forms of leukemia simultaneously. He was making no progress. None at all. The chemotherapy actually was just hurting other organs, and he was starting to have failure of kidneys and livers and such. And so he was given weeks to live. That was it. And they said, oh, but by the way, if you'd like, we can enroll you into a trial now that you're basically dead, and we can try some stem cell therapy with you. Well, what do you think his answer was, right? They just got done saying, get everything in order, you're going to be gone in a few weeks. So of course, he said, yeah, let's go as fast as possible. So they administered an IV, one single intravenous infusion of stem cell therapy. And slow but sure, over the course of several months, he began to regain strength. His cell counts began to get back to normal. Leukemia is a disease of the immune system, essentially. His white cell counts began to normalize. He was healing. His kidneys healed, his liver healed, his lungs for the most part healed. And about 6 months after the IV infusion of stem cells, he was released from the hospital cancer-free. And to this day, he remains cancer-free. To this day. So yeah, Clark is a survivor. So I was obviously, taken aback or just amazed at what could happen. It was one single IV, one time, and it overcame 2 aggressive forms of cancer and saved his life. So I began to study and wanted to know how I could bring stem cell therapy to my patients here in St. Louis. And that's what I've done. So we began to offer it. And tonight's topic is stem cell therapy and primarily how it relates to orthopedic conditions, right? We're not here to talk about how you might be able to treat leukemia with it. We can't do that in my office, or you need to be at a university setting in a hospital for that. But we can certainly use stem cell therapy for knees. And when you think about what might be possible with stem cell therapy, if we can take someone who is on his deathbed with weeks to live, organ failure, you name it, and with one IV turn his whole life around, don't you think maybe we can help to heal a meniscus, right? Or some ligaments or an arthritic joint? Of course you can. Of course you can. Stem cells can do so much more than that, but certainly they're very, very effective with orthopedic, chronic pain, and joint conditions. And so that's what we'll focus on tonight. The way that my father-in-law was able to pull through, the way that so many patients in our office have gotten better, is because stem cells actually regenerate tissue. So when you have a disease, you've got tissue that is dying. It's degenerating, if you will. And what stem cells do is they help your body to initiate the healing process, and that tissue actually begins to regenerate. All right? So, in my father-in-law's case, his kidneys, his liver, his immune system regenerated. He now has healthy liver, healthy kidneys, healthy immune system. In the case of joints, you can do pre and post x-rays and actually see the joint change. You regenerate. So we're not masking symptoms. We're not trying to slow an arthritic or degenerative process. We're not just trying to make pain go away. We're not buying time before a joint replacement surgery. Our intention is actually to help your body to heal and to fix that joint. Stem cells can do that because stem cells, a little bit of background of what stem cells are, because I get that question all the time. Stem cells are what are called the master cells of your body. So when you're an embryo and you're developing, right, everything in your body began as a stem cell. Your spinal cord, your brain, then your eyes, your organs, your muscles, your bones, your cartilage, your connective tissue, everything was at one point a stem cell. And then that stem cell went through a process called differentiation. It's a fancy word. All that it means is that the stem cell changed into what the body needed it to become. So it differentiated from the stem cell into your skin, into your heart, into whatever your body needed as you were developing at that time. All right? And because stem cells can do that, then you can use stem cells to help to regenerate lost tissue, degenerated tissue with disease. They can become anything. So like I said, we're not just looking to get rid of symptoms, we're actually looking to heal the underlying problem and regenerate your tissue. This is revolutionary because before stem cell therapy, there hadn't been any other intervention that could regenerate or heal tissue, literally heal tissue. Everything else we've been aimed to do is to try to help reduce symptoms, to try to buy time, to try to slow a degenerative process. Now we're actually talking about regenerating. And so, many patients come and talk to me. Actually, this just happened today. It was a lady who came to see me about her knees. When she filled out the paperwork in our office, though, and you have the diagram of the person, she had marked just about everywhere. She heard everywhere. Why are you here to see me? Well, just my knees. She had basically given up on everything else. And so I had you fill out those surveys in this seminar here so that we can get so that you can start to look inward and say, where really do I hurt? Maybe you're just here for your hip or your shoulder, your knee or your back or whatever it is, but do you have other things that are bothering you? Things that have been going on for so long that you've given up? I want you to not give up on those body parts. I want you to think about where all do you need help and what all can be fixed, because stem cells potentially could be an answer for all of it. So don't give up on yourself. That's what I'm trying to say. All right? Maybe in the past you've been told there's nothing you can do, just hold out for surgery, but now there's a breakthrough. You really can treat things that couldn't have been treated in the past. So how are your necks, your knees, your hips, your back, etc.? Here is a testimonial story of a patient who came into our office not too long ago that had been told by a surgeon that she needed joint replacement surgery. She had tried everything. You'll hear her story. And she didn't give up on herself. She didn't want surgery, so she sought options, ended up in my office, received stem cell therapy, and here's what she had to say. Well, let's go back to it.
Hi, Linda. How are you today?
I'm fine. Before I saw Dr. Longo on television,
We'll start it over.
I felt like I didn't have too many options.
Can you hear that?
I was not in favor of doing any kind of surgery. I'm fine. Before I saw Dr. Longo on television, I felt like I didn't have too many options. I was not in favor of doing any kind of surgery like a total knee replacement, which I had been told that I needed. I could no longer have cortisone because of a really bad infection, and I wasn't sure what I could do to improve my mobility and really get over some of the pain I was having constantly. I had never had too much problems with my left knee, but because of the pressure that I put on it, with my right knee having been so infected and involved with arthritis, it started really hurting as well. So my son encouraged me, after I saw Dr. Longo, we made the evaluation with my husband, and, and they said that stem cell injections might be just the answer. I didn't have anything to lose, and ever since I've had the injection, it's been a month, I am amazed at how much mobility I have. I have no pain in the left, minimal twinges in the right knee. I can go up and down steps better, I can walk better, I can sleep at night because I'm not awakened with pain constantly. I don't have to use pain pills, which I did have hydrocodone. I no longer need anything like that. And occasionally I'll take an extra strength Tylenol, but it's phenomenal. It's just been amazing, and I feel so much better. So I thank all of you for helping me on this journey.
Thank you so much, Linda, for sharing your story. We're very excited for you, and we're very excited to see what results we can see when we come back and see us in a few months.
Okay, I'll be back.
Thanks, Linda.
Thank you.
So that was Linda. Just a nice story about how good she feels now. She had severely degenerated knees, arthritic knees. And that's what we're going to talk about for the most part tonight, is degenerative arthritis. We'll spend a lot of time on it, usually because that's what the audience is comprised of, patients with degenerative arthritis. How many of you are here because of an arthritic or chronic degenerative condition? Okay. Let me ask it a different way. Is there anyone that's here because of an acute condition, something that's just been going on for, like a month or so, a new injury? Nothing new? One. Okay. Injury, trauma, car accident?
No, actually, I had a surgery 10 years back. That was because of bicycling.
Mm-hmm.
I tore my left meniscus.
Okay.
And then, after 10 years, it's bothering me again.
And it's back.
And it's back. And I almost postponed my surgery just to come in here.
A lot of people. So he had a meniscus injury and subsequent surgery about a decade ago. He's felt all right for a while, and now it's back with a vengeance, and so he's considering having another surgery to try to clean it up or repair it again. So meniscus tears, very, very common. In fact, the meniscus becomes thin and brittle as part of the arthritic process. So after that injury off the bike a decade ago, you might now have meniscus problems, arthritis, who knows? You can find out with new imaging. All right?
I have it.
You got it?
I have the image right now.
Oh, great. Maybe we'll look at it later. Sure. These are some of the other orthopedic conditions that often we treat with stem cell therapy. All right? Disc problems, degenerative disc disease, that's just arthritis of the disc. All right? That's the disc in your spine degenerating and becoming thin. Meniscus problems, ACL tears. I am a product of stem cell therapy myself. Last March, I tore my left ACL playing indoor soccer, turf. I don't know if you guys play sports, but running on a thick field turf is horrible. And I planted my left foot to go right, and all of me went right except for my left leg. And, went down and could tell right away that, something was really wrong. Had an MRI about 48 hours later, maybe 72 hours later or so, and had a partial tear. I was really lucky. The entire ACL, which is a ligament in the knee, a really powerful ligament in the knee, had it completely torn. If this is a healthy ACL, mine was like this. But that little bit that was left was all the difference, because if it was completely torn, I would have had to have surgery, right? That would just be two ends of the ligament flapping in the breeze. Stem cell can't relocate them together. But because I had a little bit of tissue still connected, I had hope. So, just to get an opinion of a surgeon, I did see one here in town. I won't say his name. He's a good guy, good surgeon, well known. A handful of you probably have seen him before. And he said, hey, there's some tissue intact there. If you want to try the rehab route without surgery, go for it. I didn't talk about stem cells. He said, yeah, go rehab route. Come back. Don't play sports or anything. Come back in 6 months. Let's see where you're at. So I went to my brother-in-law, who's a physical therapist, a darn good one. And he said, oh, the surgeons always overdo it. Let's go 4 months really hard, and then have another MRI, and let's see where you're at. So, okay. So I just wanted to get their opinion. I knew what I was going to do. So I went into my own clinic and had a staff member, nurse practitioner, give me actually no, it was our physician gave me an injection. Started to feel really good, began to become active, played golf without a brace, and I'm a right-handed swinger, so I'm torquing, I'm twisting onto my left leg. So I was playing golf without a brace after a month, was jogging after a month, no issues whatsoever. I got a follow-up MRI at about 5.5 weeks. So just prior to 6 weeks, we'll call it 6 weeks, I had a follow-up MRI after the first one, and the the ACL was fully intact. I had to have friends at the MRI center to give me an MRI, that quick, because insurance wouldn't cover it after just 6 weeks. So they used me as a recalibration of the machine, and instead of putting a dummy leg in there, they put my leg in there. And then we went down to the radiologist. Yeah, you gotta have friends sometimes. But it was like, a trial basically, right? How fast can this work? And at 6 weeks, my ACL was fully intact. Same radiologist that read the first one, read the second one, he couldn't believe it. I've still got the reports and the images and everything in my office. It's amazing. So I'm a product of this as well with an acute injury, an ACL tear. All right, it works. Back to the topic of the day though, degenerative conditions, because 85% of the people over the age of 65 have a chronic orthopedic or degenerative condition, arthritis. Stem cell therapy, you might read about this in the news, is used for more than just orthopedic conditions. Here's a list of many other diseases, diabetes, Parkinson's, Alzheimer's, stroke. We're not here to talk about that tonight, all right? But you will read about it, you will hear about it. We're making tremendous progress as to the application of stem cells for these diseases, and I truly believe stem cells is the future for all of these conditions. I really do. We're not there yet, but I do believe it is. Autoimmune diseases, stem cells are already being used with a lot of success. There's just so much coming. The future is so exciting for stem cell therapy. All right, in the orthopedic world, we're a little bit advanced beyond where the research is for these other diseases, but it's coming. It's coming. So, arthritis. If I use the term arthritis tonight, I'm talking about degenerative joint disease, or osteoarthritis, OA. So DJD, OA, arthritis, degenerative joint disease, it's all the same thing. In truth, arthritis is a classification of disease, and there are many types of arthritis. There are degenerative arthritis, there are inflammatory, there are metabolic, so you can have gouty arthritis, you can have rheumatoid arthritis, you can have osteoarthritis, all right? So arthritis is really many different diseases. We'll be talking about degenerative joint disease, or OA. The reason I like to refer to it as degeneration, or DJD, rather than osteoarthritis is simple. When you use the term DJD, it implies the degeneration or the getting worse of the joint. So often people think, well, I've just got arthritis. It is what it is. But it's not. It's a dynamic disease that is continually getting worse. That's why the name degeneration is built into the name, degenerative joint disease. So regardless, this is an important point, regardless of what happens to your symptoms on a day-to-day basis, if you have DJD, arthritis, your joint is getting worse. You don't always feel worse. In fact, sometimes you feel better, don't you? You wake up one morning and, hey, the stars are aligned and you feel pretty good, right? You're even able to walk or do that thing that normally bothers you and you didn't really have too much pain today. And then out of the blue, a few days later, where you thought, oh, the weather's nice, I didn't really do much yesterday, you're expecting to have an okay day, and you feel terrible, right? It's ups and downs, it's a roller coaster. But underneath the surface of your symptoms, the joint is continually, slowly but surely, getting worse and degenerating. So you have to understand that. You can't gauge the health of your knee or your hip or your back or whatever it is based on how you feel that day. If you know you have DJD, arthritis, then it is getting worse slowly but surely, day after day. So I've got some x-rays to illustrate the progression, and I'm going to use knee x-rays a lot tonight because knees happen to be the most common thing people come in to see me for when they're seeking stem cell therapy. Right. How many knees do we have in the room tonight? Raise your hand if you need. Yes, so, okay, knee problems, right? So most of you that are here tonight are here for knees. That's how it normally turns out. So this isn't a patient of mine, this is just a picture from a textbook, okay? This is a knee, all right? It's a knee that's looking back at you, so this is actually a right knee. I know that, but you might not be able to see this from in the audience, but here's your fibula, which is the little bone on the outside of your lower leg. All right. So we always know there's the fibula, and this is the outside of the knee. All right. That means this is the middle side of the knee. It's clear that the middle side of the knee joint has less space in between the bones versus the outside of the knee joint. Everyone can see that. This is a very good picture to show the prototypical kind of moderate stage of degenerative arthritis. In most cases, unless there's a biomechanical issue or a weird trauma, you begin to have arthritis that starts on the medial or the middle side of the knee. So that's what we see here. This is arthritis, all right? We know it is because the space in between the bones is getting closer together than it should. So we don't see the cartilage in the meniscus wearing out or degenerating in this picture, but we know it must be, or those bones wouldn't be able to come closer together, because the meniscus and the cartilage, that's the cushion in between. So a doctor can look at this and say, yes, this person has degeneration of that cartilage, of that cushion, and so the bones are closer together. That sets up a process. When the bones come closer together, that increases the pressure inside of the joint, which leads to pain and inflammation, which then leads to a further degeneration of the cartilage, which leads to more pain and inflammation, and the bones coming closer together, which leads to more, you see where this is going? It's just a nasty cycle, and that's why it's a degenerative condition. And there's nothing that can be done prior to stem cells to stop it. You can slow it, you can get relief from the pain periodically, but prior to stem cells, there was nothing that could be done to reverse that or to help the body to fix it, okay? If you leave it alone then, mobility decreases with this, right? Range of motion, your ability to do things gets worse and becomes lessened as time, slowly but surely as time passes, and that's because the joints are coming closer together. Yeah, there's a pain component to it, but there's also just a range of motion component. If the bones are closer together, they can't move as freely as they should. Imagine my hands here. If this is a bone and this is a bone, my hands can move freely, independently. I have a lot of range of motion here. But if my hands are closer together, my hands can't move as much. All right, simple analogy that shows the point of what happens with arthritis. As the bones come closer together, your range of motion is decreased. That also sets up more degeneration in arthritis. As it continues, we now have an x-ray here. Again, this is just out of a textbook. We can now see the middle side and the outside region. And this is actually a lefty now. Here's the fibula. So now this is the outside and this is the inside of the joint. And you can see in this picture, both sides are looking pretty nasty. All right? The bones on both sides are. So this would be more advanced or severe arthritis. The bones don't look healthy. You can see bone spurring happening on the outside there. Bone spurs are not independent of arthritis. That's part of the arthritis or the degenerative process. All right? Bone spurs don't normally cause pain. They're just, your body is trying to stabilize the joint. There's a law called Wolff's Law. And if there's increased pressure on that joint, then the body is going to draw calcium to that area to try to create more surface space to spread out the pressure, the increased pressure. So more surface space can spread out the pressure inside of the joint. So your body's doing naturally what it should if there's increased pressure or instability. When the body suspects instability, it will also try to lay down more bone. So bone spurs happen as part of arthritis. They're not like, I've got bone spurs and I've got arthritis, can you help me with both? I hear that all the time. It's all part of the same process, okay? You can see this person is getting much worse. So, when you get to that point, most of the time people have been through a series of treatments already. And most treatments fail because they're not aimed at actually fixing the underlying problem. The problem with that joint is that the cartilage is wearing away and degenerating. The joint itself is becoming more unhealthy, right? It's not a pain issue, it's a degeneration issue. But most treatments are solely aimed at trying to treat the symptoms. So let's dive into what the common treatments are, because I bet most of you have been down this path. You start with a little ache or pain and it's new to you, so maybe you go to your medicine cabinet and you pull out the Tylenol or the Aleve, whatever you have sitting around the house. That doesn't work, and so then maybe you see your primary care doctor and he gives you something a little bit stronger. That doesn't work, and so then you start with injections. You get sent to a pain specialist or an orthopedist. Sometimes a PCP is skilled and can do injections in their office, and you start with injections. So let's touch base on that process. First of all, the pain pills. Some of you in this room probably take them, and I understand you're in a lot of pain. But you know you're not fixing anything. And we know that they're highly addictive. All right, this country is in a major epidemic right now. It's been declared a national epidemic, right? There are write-ups in the newspaper every day of overdoses. There was a Post-Dispatch article, the local St. Louis paper, that said that in the city of St. Louis, there are enough opioids prescribed every day, this was fall 2017, for every person in St. Louis to have, it was 1 or 2 pills a day. It's insane. It's insane. And St. Louis isn't even like the worst of the cities. It's not in Tennessee and some of the southeastern states. It's way worse than it is here. But even here, more than a pill per person per day is prescribed. Highly addictive. They're ruining lives. Anti-inflammatories cause organ problems. The list goes on and on with the pills. And you know inherently that you're not fixing a knee problem by taking a pill. You're just trying to buy yourself time. So then you go and you have the injection. I get it. An injection might be able to, a cortisone injection might be able to give you months of relief. But again, cortisone injections don't fix anything. In fact, cortisone injections can make arthritis worse. Cortisone will demineralize any tissue that it's injected into. All right? Any tissue that it's injected into. So, you have a joint that's degenerating. The cartilage is wearing thin. It's becoming dehydrated, it's becoming brittle, it's becoming weak, it's potentially tearing, and then you inject a substance into it that will remove the inflammation, thereby giving you pain relief for a matter of time, but at the same time making that joint more brittle, wearing away the cartilage even faster than it was already wearing away. So is that a long-term solution? No. All those shots do is put you on a faster track towards surgery. And most people who give those injections will admit as much. They know they're not fixing you, they know they're just buying you time, they know the side effects of it. But prior to stem cell therapy, it was kind of a mindset of why not give the cortisone injection? It allows you to go about your day, go to work, do your thing, feel better for a period of time, because in the back of their mind, they know that a degenerative joint is going to end up at a surgeon's office. It's just how long can you hold out? How long can you deal with the pain? How slow can your body, how much can you try to slow the process down with your body's own healing capability, but nothing can stop it. So that person giving you the shot knows you're headed for the surgeon's office at some point in time, so why not make you feel better along the route? I get it, and I get why you would have the shot. But now that there's stem cell therapy, there are options, all right? And there have been some other options that have hit the market in the last several years. Hyaluronic acid injections, people call them rooster comb shots. There's a lot of brands on the market, Hyalgin, Synvisc, Orthovisc, Suparts. They're all essentially the same thing. It's injecting joint fluid with some collagen back into the knees or to the hip, any weight-bearing joint those shots can help you with. Those will not cause further degeneration, but they also do nothing to stop the degenerative process. So they don't have side effects for most people, right? Most of the time there are no side effects from having that injection. It can give you a little bit of a cushion, right? You're putting fluid in there, so it's like a hydraulic buffer, if you will, and it gives you a cushion and feels good if you're lucky for, up to 6 months or so. So that's all right. But you're not fixing anything. Your joint is still headed towards the surgeon's office, all right? Once you get to the surgeon, well, first let me ask this. How many people here have had joint replacement surgery? A few, all right. So I always have to say this. If you're here to learn if stem cell therapy can help with that joint that has been replaced, it can't. You can't regenerate metal, right? You no longer have your joint, your knee, your hip is gone. You now have rods and screws in its place. So we can't treat that area. But if you've only had a partial replacement, like you'll see x-rays of a patient of mine that had a partial knee replacement. He did not want one, but not the other. We can always do the other. And if you've had one side, but not the other side, then we can also treat that. We won't fix, if you've had the medial side replaced, but not the outside, then we can't do anything about the middle side, but we can try to help the outside. You'll see a patient of mine's x-rays, actually, where we did just that later on in this presentation. If you've been through joint replacement surgery, which a handful of you had, you know it's no walk in the park. There's a lot of rehab, there's a lot of risk. It doesn't always work. Sometimes it does work, and that's great, but even when it does, that joint, that replacement joint will wear out in time. So there's a clock that starts once you have your joint replacement surgery until when is the next one going to be needed. And that's a scary prospect because it's a major surgery, right? So most ethical, really all ethical surgeons will tell you to do everything you can prior to surgery, all right? And so doing everything in the past was rehab to try to strengthen muscles. Well, that doesn't stop the arthritic process, right? So PT won't do it. And to have some injections, just hold out and tolerate the pain until you can't do it any longer. But now there's another step. Now there's stem cell, which you should always do prior to surgery. I shouldn't say always, because there are cases where you do need surgery, right? There could be infection, you could have a particular case. But in many cases, in most cases, you should explore stem cells prior, because after stem cells, if they don't work, and stem cells are not a cure-all, you're not going to hear me stand up here and say that 100%, if you've got arthritis, do stem cells, it will fix you. That would be a lie. All right, everything has a rate. Studies say that you're looking about 80-85% of the time. So you got north of an 8 out of 10 chance that stem cells will do the trick for you if you've got degenerative conditions. But that does mean that 1 or 2 out of 10 people aren't going to get fixed. And so for those 1 or 2 out of 10 people, you can still have surgery if you want to go that route. But you can't have surgery and then try stem cells. So the order becomes pretty clear as to how you should do things and how you should line up the order. I've got other slides here. Sometimes I get off track and I spend far too long talking about the cost of surgery and the rehab and everything else that goes with it, how gruesome it is, infection risks. Most people probably know someone that's had an infection secondary to a surgery, even if it's just a minimal surgery. It can be expensive. This was a study out of Dartmouth that found that if you've got Medicare in the country, your average out-of-pocket expense is $4,500 for the surgery, $5,100 after your rehab. It's expensive, even if you're insured. It could be very expensive, and that doesn't take into account the lost time, function, pain, suffering, all of that. So, you guys are here because you want something else, so I'm not going to spend all that time talking about surgery today. Here's a cartoon I've inserted that reminds me of, this is basically what happened to Clyde, my father-in-law, when he was at University of Iowa. He was, they did everything and he was about dead, and then they said, hey, do you want to try stem cells? So the cartoon says, if you can't read it, we've exhausted all conventional measures. One last desperate option is to put you on an alternative natural medicine that has a 96% success rate. So let's talk about stem cell therapy. There are different types of stem cells that you can have injected into your joints for degenerative conditions. 2 of those are what we call adult stem cells. Adult stem cells can come from your bone, so we'll call that bone marrow, all right, where you actually go into your bone marrow and suction out some of your marrow, spin out the stem cells from that, or you can harvest stem cells from your adipose tissue. So it's a minor liposuction procedure where they'll go in around your umbilical cord and they'll take out some adipose tissue, spin that out, and harvest the stem cells from it. All right, those are surgical procedures to have that done, but it can be done in a clinical setting and you can harvest stem cells from that. Or you can purchase stem cells from donated umbilical cords. All right, we'll talk about the differences between them. Notice that I've got a line through, we're not going to talk about embryonic stem cells. There was a lot of press and ethical concerns, moral concerns, rightfully so, with stem cell therapy being done using cells harvested from aborted fetuses. And so, we're not going to get into that, but that's illegal now in the U.S., and that's not what we're talking about here tonight. All right, tonight, what we're going to be talking about are the differences between adult harvest and umbilical cord. And you'll find that I'm a proponent of umbilical cord. And I'll lay out the reasons why tonight. These umbilical cords are just donated by mother. Has anyone here know someone who's donated an umbilical cord? 2, 3, 4? Okay. Yeah, I'll make 5. My wife, I've got a 5-month-old actually, and all of her OB-GYN and her doctors are all part of the Mercy Network. And early on in the process, her OB-GYN asked her, what do you want to do with the umbilical cord? You basically have 3 options now. You either say, well, I want to throw it away, which I don't know why someone would choose that, but you can. It's your body. If you want to have the umbilical cord thrown away, they will. That's what's happened for decades and decades prior. Or you can choose to keep it yourself and contact a tissue bank, and they will come and they'll pick it up. They come right in there. It's what we chose to do. They come right in after the delivery, and they pack it up and cryopreserve, and they get it off to a tissue bank within, right after you give birth, or you donate it. And that's what most people are doing, is donating to tissue banks, so the tissue bank can then harvest the stem cells from that donated umbilical cord. Okay? So completely ethical and very, very safe to do. To determine what type of stem cell therapy might be best, there are 3 main points to consider. All right, and we'll contrast adult stem cells, so I'll lump bone marrow and adipose tissue stem cells together, and we'll call that adult stem cells, versus embryonic stem cells. All right, but excuse me, not embryonic, umbilical cord stem cells. All right, so we have umbilical cord and we've got adult. Adult come from you, from your bone marrow, from your adipose tissue. Well, the first difference between the two of them has to do with how many you get. All right, as you age, the amount of stem cells in your body decreases dramatically. So when you take any part of tissue out of your body, the older you are, the fewer stem cells you will have. The younger you are, the more stem cells you will have. You've experienced this, like you don't heal quite like you used to, do you? You don't bounce back from things like you used to. You don't have the healing capacity that you used to when you were younger. And there's a reason why. When you're born, 1 out of about 10,000 cells is a stem cell. As you age, it drops down dramatically. So by the time you hit 50, about 1 out of every 400,000. Age 60 is about 1 out of a million. Age 80 is about 1 out of 2 million cells as a stem cell. So if you were going to have a therapy done, would you want a large number of stem cells or a small number of stem cells? You want the most. There are studies that prove without a shadow of a doubt that your outcome is largely going to be dictated by the quality and the quantity of the cells you get. All right? The more cells you get, the better chance you have of recovery and regeneration. So which tissue do you want to use? Obviously, you want to use tissue that's very rich in stem cells. So this is just a general study of, how many stem cells might you have. Let's turn this into a clinical setting. After you harvest tissue from your adipose tissue or your bone marrow, we know that you're going to get, on average, about 1 million stem cells. All right? If you're doing bone marrow, it's probably going to be less than 1 million. If you're doing adipose tissue, it might be right at 1 million. But if you're lucky, you're going to get probably 1 million of your own stem cells to be injected back into your tissue. Okay? On the flip side, if you're using umbilical cells, protocols call for about 10 million cells for every large joint. So in our office, we use a tissue bank that gives you a guarantee where if we're going to do, say, a large joint like a knee or a shoulder or a hip, you will get at least a minimum of 10 million live nucleated cells for every injection versus 1 million live nucleated cells using your own tissue. 10, 12, 13 times as much, because most of my patients actually get about 12 million, 13 million cells. That's what the average is. There's a white paper published by the tissue bank. They give you a guarantee of 10 million, you're probably getting 12 or 13 versus 1 if you're lucky. You want more, right? The more cells, the better. You simply can't get more cells from your own tissue. You just can't do it. The other thing that happens is that as stem cells age, they change. Stem cells from an umbilical cord are what are called pluripotent cells. Pluripotent is a fancy term. All it means is this. Stem cells from umbilical cord can become anything else. They have the potency to become whatever your body needs. So if we inject it into your hip, it can become hip cartilage. All right, if we inject it into your shoulder, it can become a rotator cuff tendon. If we inject, you get the point. It can become whatever you need. As you age and you become an adult, your cells are no longer pluripotent. Your stem cells are now what are called multipotent, meaning they can become some things. You don't know what stem cell can become knee cartilage if you need your knee repaired. You just know that you've harvested cells, say, from your own bone marrow, and some of them probably can become bone marrow or knee tissue, but some of them can't. They're multipotent in nature. So when you get that injection of 1 million cells, some of them can't even become knee tissue to begin with. versus getting injection of 10 to 12 million cells, and you know all of the stem cells inside of that injection can indeed become the tissue that you need. Clear winner there, right? Beyond that, there is a process called senescence, and I don't know what happened to the slide on this. I might have already passed it. I'll talk about the third key point. Senescence, that's the doctor term for aging, all right? Your stem cells have been around and have been replicating as long as you've been alive, right? The stem cells you have now aren't the same stem cells you had when you were born, just like your blood and your bones. Those cells are replicating, right? Every time that stem cell replicates itself, that's one less time that it can replicate in the future. That's just aging, okay? So the younger the cell, the more potency there is, the more it's going to be able to proliferate or regenerate. The older the cell is, the fewer regenerative cycles it has less. So if you're going to try to fix, say, your back or your shoulder, do you want a cell that can regenerate and replicate itself many times and become a lot of tissue? Or do you want a cell that can replicate a limited number of times and become limited amounts of tissue? You want the most healing possible, right? You're trying to fix the darn joint. You want the cell that can give you the most healing capacity. Well, the cells that are younger will have the most healing capacity. So, no offense against anyone in this room, but none of you are as young as an umbilical stem cell. So none of you have the potency inside of your own stem cells that an umbilical cell does. When you factor all three of those together, you're not going to get as many stem cells if you use your own. The stem cells that you do get, some of them can't even become the tissue that you want, and none of the stem cells have the regenerative capability of an umbilical cell. There's a clear winner. Right? Now, this is not just my opinion. I've given you guys a handout that comes from a research article, and I've got a couple articles up here as well that state the same. All right? All I've done is just given you a synopsis of the most recent literature. So this slide comes from the Journal of Stem Cell Research of 2015. It says that human umbilical cord tissue contains an abundant supply of mesenchymal stem cells. So that top line says umbilical cord has a lot of stem cells. All right? There is no need to collect stem cells through invasive procedures such as liposuction or bone marrow collection. Those are painful, invasive procedures. And umbilical stem cells proliferate and differentiate more efficiently than other types of stem cells and are therefore considered more potent. That's what I just told you guys, okay? So there's what it sounds like in scientific journal language, and I've already given you that in normal language. This comes from the Journal of Molecular Sciences. Umbilical cord blood, umbilical stem cells, are considered the most suitable because they're free from ethical complications, easy to isolate with non-invasive methods, produce large number of mesenchymal stem cells, and possess immunosuppressive activities, making them safe. All right, so they're safe to use. On the contrary, adult bone marrow and adipose tissue, so the other two types that come from you, are limited because harvesting requires invasive procedures, and the mesenchymal stem cells derived may be clinically ineffective because they're old and you don't get too many of them. All right? Therefore, umbilical cord blood, mesenchymal stem cells, could be cultured significantly longer and exhibited the greatest expansion capacity. They can become more tissue. All right, so you're trying to fix your knee. Umbilical cord stem cells can become more tissue. All right? Whereas adult stem cells, adipose, had the shortest culture time and lowest growth. There's a winner. This isn't my opinion. This is just coming from the scientists. Now, if you would have asked me several years ago, I would have said, get out there and take stem cells from your own bone marrow, do the adipose harvest, because we didn't have the science backing up umbilical cord blood at that time, or cord tissue. Right? We didn't know. In fact, some of the early science, some of the early tissue banks hadn't got the process down appropriately, and a lot of the cells were dead. A lot of the cells were dead. We found that just a few years ago, amniotic tissue hit the market in a big way. Amniotic tissue is in regenerative medicine. It has some good characteristics. It's not a bad thing, but it's not stem cell therapy. But a lot of people were marketing amniotic tissue as stem cell therapy, and we didn't know at the time because it has stem cells in it, but they're all dead. By the time you go through the processing of the amniotic tissue, the cells all die. And so we thought that was happening with cord tissue as well. And so it was kind of written off, and adult harvest kind of ruled the day for a matter of a few years. But now the harvesting and the processing techniques have been, I don't want to say perfected, but greatly improved. And so now we know that we're actually getting live cells. This has all been proven out. There are papers and white papers showing it. We might even have pamphlets. Did you bring any of the big trifold pamphlets? Sure. You do have some? So if anybody likes science and reading that, then grab one on your way out. We actually have a synopsis of that white paper showing, yeah, these cells are all alive and they beat the other types. So as science changes, I change with it. I want to give you guys the best. And right now, as we sit here today, I don't have any doubts that umbilical tissue, if you're going to do stem cell therapy, is absolutely the way to go for the reasons we've already described. So there you go. You get the most cells, along with the growth factors, the cytokines. We won't get into all that. The science, you need other stuff to make them work really well, and our injections have that. They're the best. And they're safe. This is a question that always arises. Yeah, but if you use your own stem cells, I mean, they're yours, so you know you're not going to have a reaction to them, and they're safe. What about if you get these cells that are donated from somebody else? They're safe. If you get umbilical cord blood, it's safe. There have been over 1 million procedures performed, never a single adverse allergic or immune reaction to them. The science reason why is here. All right, this comes out of Case Western Reserve University. It was published in Experimental Molecular Medicine. What it says is that the cells that you get will be immunosuppressed. They won't cause your immune system to reject them. They will simply help your body to regenerate and recover the lost tissue. There's never been a reaction, and there shouldn't ever be. All right? This is different from if you were just a good pal and wanted to give him stem cells. The odds are overwhelmingly, like basically you got better odds of winning the Powerball, that he's going to reject your stem cells. Okay? This is very, very different. All right? These are immune privileged cells that can be used in any person. All right? There's no DNA matter being transferred. All the red cells have been taken out. You're just getting the stem cells and the growth factors. All right? So it's very, 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 very safe. Here's a layman term synopsis of the previous slide, but I basically already went through that. You get other things that help the stem cells to be better as well. I don't think we're going to get into this tonight. It's a little bit too sciencey, but stem cells work best when there are other things kind of injected at the same time with them that help the stem cells to stabilize and to follow the signaling process that your body's giving off to be able to go to the right spots and heal the right spots. All right, we make sure that you get all that at the same time. How do we get them? They're shipped to us, cryopreserved from the tissue bank. It's a really easy process. It does take some logistics. We got to plan things in advance, but it happens very easily. The tissue banks are all following FDA guidelines. Donors are tested. Everything's safe. There's lots of layers of testing. If people like to read guidelines, there's the FDA guide. It's just tissue banking guides. Everything that you get is safe. It's been tested. There aren't ethical concerns, all right? This is all, it's really neat science, to be honest with you, and the process has really came a long way. So the take home is just this. The cells are safe, they're clean, and they're effective. We talked about that, the effectiveness. 8 out of 10 plus success rate with degenerative joints, all right? And those joints, people choosing to get stem cells, just like you guys in this room, it's not like you just got hurt yesterday, right? Like I was an acute injury and I, jumped on the ball and got it done within a matter of days of hurting myself. That's not what walks into my office. That's not what walks into anybody's office or across the country doing stem cell therapy. You get the people that have been forced with the decision, are you gonna do surgery or do you wanna do this, right? You're sick of the shots, it's not working, the pain's horrible, your quality of life is going down, you can't run and play with the kids, whatever it is, and you're saying to yourself, am I going to follow through with the surgery, or am I going to do stem cells? So we're getting bad joints, all right? Usually, most people tell me, Doc, it's bone on bone. I just want to see what you have to say. There's no hope. I've already been told it's bone on bone. I got to have the surgery. That's the typical person that has success doing this procedure, all right? And it's still 8 out of 10, 85% success rate, all right? People like to see pictures, right? A picture is 1,000 words. So here's the pre and post. It's not just the cartilage that healed, that bone looks a whole lot better, doesn't it? The bone looks better. Here's Big Al. This is the patient that I was referencing. We just took this post x-ray this past fall. You can see which is which, right? Here's pre. Look how gnarly the bone is being eaten away. It's terrible. You can see this is his half replacement, so I mentioned how you can have part of the knee replaced. And so we didn't do anything to fix the medial side of his knee. It's the same. But the outside was going to have to be surgically repaired as well. And now he's not going to have to. Look at how well his bone is healed. All right? Look at the difference in the space. It's beautiful, isn't it? It's beautiful. This is about 5 months. That's 5 months on Al there.
Will it continue?
Usually the process stops somewhere around between like 5 and 7 months. So I always tell people we can do your post x-rays, sometime in there, depending on how good you're feeling and whether you want. I can't force somebody to have post x-rays. I like it for these reasons and for, clinical certainty. But some people are like, you know what, Doc, I don't want to pay the copay, or I don't want the radiation, or whatever it is. If you're happy and you're loving your life, then don't. But I would encourage you to get post x-rays. All right. If you follow my inclination, we'll get post x-rays on everybody. So we can do this. All right. This picture is not a patient of mine. This picture was taken at a friend's clinic just outside of Atlanta. And you can see the heading on it. This is after 8 weeks. I was there for this, so I feel okay using this picture, even though it's not my patient. I was visiting him, and he ran into clinic, and this was a lady, actually, after only 8 weeks. And so the x-rays were donated. Insurance wouldn't pay for a follow-up x-ray at 8 weeks. But the lady said, yeah, if you're not going to charge me all of x-rays, let's see what's going on. Because she was just raving how good she felt, and she was active, and all this where she hadn't had anything like that. You could see, she was shocked, right? Right? This is about as, quote, bone on bone as you're going to see. And stem cell injections rather than surgery. And at just 8 weeks, we see clear signs of repair and regeneration. All right? So I wasn't around. I don't know if she went back at 6 months and had another set done. I don't know. I was just there for this day and was able to take a disc home with me. Really neat stuff there. So this is another evidence. Mine was 5.5, 6 weeks post ACL tear, and this was 8 weeks on X-ray. It's really neat what can happen. Those are bad knees. All right. These are bad X-rays. This is really on the way up. So that's neat. That's neat. It's not just ordinary folks getting stem cell therapy. The best of the best in the sports world are getting stem cell therapy as well. Everybody on that list, even if you're not a sports fan, you probably know some of these names, all right? And if you're not a sports fan, what I can tell you is that this group of people, Tiger Woods, Peyton Manning, Kobe Bryant, Jordan, these are the best, all right? Money's no option. They're going to do what allows them to be at the top of their game or in retirement to live their best life, and they've all done it. All right? It's for everybody. So here are a couple more patients of mine that figured there was no hope, figured they'd have to have surgery, and decided to do stem cells. It's a mother and daughter, so that's why they're sitting together. And here we go. I keep doing that. Sorry.
And how are you feeling 1 month after the procedure?
Okay, when I came into the office, I had been getting the
shots in my leg for years, and I'd been suffering probably for about 7 years. Not really getting to do the housework and the work that I really needed to do. Just my life was on hold. I had the shots, and I think I did wonderful when I first got the shots, but I had to get them in both knees. And I think I did wonderful the day of getting them, and the previous weeks after that, I keep getting better and better. And I am pain-free. I put 0.5% in there just to say I have some pain, but I don't really I'm pretty much pain-free.
Good, that's really glad to hear. Carrie, if you could tell us a little bit about your experience as well.
Okay, well, I was diagnosed probably about 6-7 years ago with degenerative arthritis in my knees, both knees. And I've done Synvisc, I've done cortisone shots, and still the pain continued. And I was at really optimal pain. And then I had discovered this through Bonnie, this procedure, and we had it done before Christmas. And the biggest thing that I have noticed is that I am able to, it's a little thing, but I can get up and down off of a chair. I could not do that before. I was at so much pain, and I was also in extreme pain in my resting state. Sitting, sleeping, I could not get any rest at all. I have no pain at this time in a resting state. But I'm not gonna lie, I do have some stiffness and a little pain still, but we're in the early stages. And I know that every day, I will say, today has been really a very good day. I really, the pain has decreased tremendously today. So I can only hope for every day to be better.
Well, I'm really glad to hear both of you are having success. And you're right, it's only been a month, but we have several more months as part of the process to see where you'll end up. And prospects are looking high for both of you, and I'm really glad to hear that you guys are having a wonderful experience. And we look forward to seeing what more positive changes come about in the future. Thank you for sharing your story.
I didn't know the last 20 seconds was just Ryan talking. I would have cut it off. Didn't make listen to Ryan talk. So there you go. Just some more people that are happy about it. I like to use those a couple because they're early on in the process. And people ask me a lot, well, how fast does the pain relief happen? What can I expect? This stem cell therapy is not a pain shot, all right? The intent is not to reduce pain. The intent is to regenerate the knee, to help the body to heal the knee. And that process takes time. But what's neat is that pain relief does usually start to happen somewhere between like month 1 and 2. All right, somewhere between month 1 and 2, you start to feel better. Some people get pain relief right away. That's not to be expected, all right? You should expect a gradual process starting after 30 to 60 days. And then it just continually gets better. As your motion gets better and as you become more active because you can do more, it just gets better and better and better. I see some, you're not alone, I've seen some questions, some hands go up. Yeah, I was about to say that. If I don't get to your question or I haven't, write it down and I will stand up here until they kick us out of the room tonight, answering questions if I need to, okay? I sure will. A couple questions I get asked a lot. How many times, is it just one shot? It's usually just one. It's usually just one, and it fixes it. That's not the case with adult harvest because you don't get many cells when you do that, but with umbilical, it's usually just one. It's an in-office procedure, in and out, same day, no downtime, no days off work, nothing like that. Okay, you come in, you get it, and you're out. I would ask you to take it easy for a few days, certainly, but other than that, after a few days, resume your normal activity. All right? And hopefully just over time you're doing so with less pain until we can really increase that and get you much more active, which there's whole protocols. We get into all that as you go and you get better. We really start to get you more active. All right? So that's the science behind this. All right? You guys needed to learn that. You needed to know what stem cells are and the different types of therapy. But you're not really here for science, you're really here to find out, can it help you? All right? So I want you to think about, could you be like some of the people who gave their testimonial? What's key? What are you unable to do? You know, what's been taken away? What do you want back? Have you worked your whole life to retire and now you're retired and you can't enjoy it because you're in too much pain? Are you not taking a trip? Are you avoiding something? Can you not play with grandkids? I don't know what it is. I do know this. Very few people come in to see me because they hurt. People come in to see me because they hurt, which has caused them to not be able to something. And it's different for everybody, but you've all got your something. That's why you're here tonight. That's what I want to help you guys to get back. And that's what you need to think about when making a decision if you want to explore this or not. All right? I make it easy on you to come into the office. All right? I think I've got it written out. The process, you're not choosing tonight whether or not you want stem cell therapy, and I'm not accepting you as a patient into stem cell therapy tonight. It's way too early on in the process for that. There are steps we have to go through to make sure that this is right for you. The first step is just to come into the office, all right? If you have imaging, bring it, all right? If you want to step aside, I'll look at it tonight. I got no problem doing that, okay? But bring your imaging if you have it. If you don't, then we'll get updated imaging so we can see what's going on, all right? If your images are more than 6 months old, we'll probably want to get a fresh set so that we can have a pre and a post. If I don't think you're a good candidate, I'll tell you so, all right? Just today alone, just today, 2 people came in seeking stem cell therapy, and I said, no, you should do this or you should do that. They just weren't good candidates. So I'll give you my honest opinion, all right? I can't just willy-nilly allow anyone that says, hey, give me stem cell therapy to have it. If I don't think you're a good fit, my reputation will be tarnished, our clinic will be closed. So I'll be honest with you and I'll tell you what I think.